So I don't have anything scripted. So I'm just riffing off the top of my head about how I feel. And I just recently got a call from, or no, I didn't get a call from UC Davis. I actually called them and to see, if there was anything else that I needed to do. And I was informed that there were two more things they need me to do. And these things weren't things I was, you know, privy to when this whole thing started. They said that they needed me to speak to their psychiatrist and they needed another procedure done. It's called a catheterization. Now, the first part I'm not really too clear on what it is, but I know that from what they've explained to me, it is a procedure that involves cutting into the groin and inserting a dye to check, the heart valves and heart chamber, things like that. I think that's what they're going to do. But that being said, there is a level of frustration that goes along with that because I was under the impression that I was done. I was under the impression that once they did the nuclear stress test, that was it, and I was going to get listed and everything was going to be fine. Well, with CPMC, I'm on their list, right? So I'm accumulating time, whatever. But I'm not active. Now, I didn't know that there were two parts to this. I thought once you were on the list, you were just on the list. Well, I just recently found out that I am on the list, but I am not active. I am not an active recipient. So, meaning that I am not eligible to get a kidney until they submit my case to a committee. And then from there, they determine what else they need me to do. So supposedly with UC Davis, once these two are done, they're going to submit that back to the committee and then we're going to see what they're going to do. My issue with that is I put a lot of hope into this as far as, I'm going to get on this list. I'm going to, I'm going to get selected. I'm going to get chosen and I'm going to move forward. And it seems like everything in the universe is trying to stop this from happening, or not so much stop it from happening, but just hold me up and inconvenience me. And you'll have some people who will, so what? You're just going to do these, just quit bitching and just do these two procedures and just stop bitching. Well, the reason why that's a big deal is because now, going back to what I was saying about psychiatrists, it is May. It's the beginning of May right now, right? It's like May 13th, May 12th, or no, it's like May 13th right now. And they're booked up until late July, early August. So that is a significant amount of time that's going to go by. That is one out of the two things that they cannot get done in a timely manner. So what I've decided to do was I've decided to speak to my primary care to see if they can get me a psychiatrist that I can speak to. So that way they can just take that information and just give it to UC Davis because they're all booked up. Right? And that's just, this whole process is just starting to piss me off because all these people who are supposed to be in these positions to help me just aren't. They're just not. And it feels like these transplant centers are doing everything in their power to not help me. And it's starting to piss me off. And with the catheterization procedure that you're supposed to do, I'm going down there just to talk to them about it, not to get it done, just to have a consultation with them about it. And all of this stuff is just taking so much time. And I bet you're thinking to yourself, well, what's the big deal? What's the problem? Why don't you just stop bitching and just wait? Be happy waiting like everybody else does. Because every week, every month, every 2 months that goes by, and I'm not in their pool, I'm not active, that means that I'm missing out on potential opportunities to get the help that I need in order to get a kidney transplant. That's why it's important. That's why it's pissing me off. That's why it matters to me. And it wouldn't be so bad if the workload was spread around to like others, or if there were a sense of urgency about trying to help me. Because they say that somebody in my age range, they say they want to help them, but then I just sit around and I have to call them and listen. I'll give them the benefit of the doubt, and I'll give them as much consideration and as much understanding as I can. Listen, I'm not the only person that they see, and I understand that. And I am not the only patient they have, and I understand. Nor would I ask them to drop everything they're doing just to help me, because there's other people that need help too. But if they're telling me that I'm a priority because I'm in an age group where I am a priority, then start treating me like a priority. I shouldn't have to keep calling and calling. Now, I understand that, me being a relatively able-bodied person of mind, I can call. I can do the footwork. I'm not a confused old man who can not use a cell phone and doesn't understand what's going on. Like, that's not me. So I understand that. But when it's always me every single time, and then the excuse they use is that, well, you got to be your own advocate. Okay, that's great, but I've never done this process before. I have no experience with this. I'm walking around blind. I'm making appointments with people by mistake, and then I'm getting results by accident. Because I just happened to make an appointment with a doctor that knows something about this and I don't. And the people that I'm speaking to just sort of laugh it off. Hey, man, they make you jump through a lot of hoops, man. And then they go over here and they talk to, guy over here that's, sitting in chair 13 or whatever. And once again, I'm left stuck and angry and frustrated and sad because I'm just sitting here waiting. Now imagine if I didn't do anything, right? Imagine if I left everything for everybody else to do, nothing would get accomplished. And it's a terrible feeling to not get the level of support that you feel like you should be getting, and that you have to feel like you need to beg for it from people. Please help me. Please help me do this. Please help me do that. I'm not a priority on anybody's list of things to do. And it's not something that I'm not used to. I'm used to it. I've been an afterthought with people my whole entire life. I've never been a priority to anybody except for like my mother. And maybe a few people here and there, but it doesn't last for too long, so I'm used to that. With something this big, I can't be an afterthought. I can't just be somebody that, people can just sweep off to the side and they'll get to me when they feel like it. Like, to them, this is just their job. They just clock in, they do their job, screw these patients, whatever, screw these patients. What's for lunch? What are we having for lunch today? Clock out and go home to their great lives. But for me, this is my life. My life is depending on this stuff to get done. And I'm surrounded by individuals who don't really understand the magnitude of that. And if they do, they don't really take it that seriously. And this is not me saying that they're bad people. That's not what's happening here. It's that, like, I need this. I need this more than anybody who works in this profession understands that I need this. To them, this is just a job. They can quit this job and go do something else. I can't quit this. I'm here 24 hours a day, 7 days a week. I never get to clock out. I never get a vacation. There's no paid vacation leave for me with this. This is what I do. And if there's an opportunity where I can be helped in a timely manner, I want to capitalize on it. I want to take advantage of it. But I'm constantly getting pushed back. And now I have to wait again. And it feels like that's all I've been doing is just waiting and waiting and waiting. When I had HLH in the hospital for 30 days, I had to wait. Then when I got out, I had to do chemo. I had to wait. Then when the chemo was over, I had to wait to feel better. And then I was basically just waiting for my life to end when I got kidney disease. And then I had to just wait until I got on dialysis. And now that I'm on dialysis, I have to wait to get on the kidney transplant list. And now that I'm in the process of getting on the kidney transplant list, now I have to wait for these people to decide they want to fit me into their itinerary to try to help me. And I'm tired of waiting. I'm tired of it. I really am. Like, I'm starving and I'm ready to eat. I don't want to eat table scraps anymore. And I've mentioned this in other videos, like I'm tired of trying to find the silver lining in like all of these shitty situations that I find myself in, because it seems like those are the only situations that I'm ever in. Are just shitty situations that I have to find the best in. I just want it to work. And I disagree when people say that, well, everybody goes through something. No, they don't. There are people who go through their lives. There are people who go through their lives and it's very easy. Nothing too terrible ever really happens to them. And it's just a great time. But for me, and this is not me complaining or me bitching in a video. This is real. And if anybody that knows me knows that this is real. I've been fighting and scratching and clawing just for the most minimal of happiness my entire life. And this situation is no different. And I see something right there. It's just right there that can help me. And I'm getting all this resistance. Especially from the people who are supposed to want to help me. So, that's what's been going on. So once again, I'm stuck waiting to see if something opens up at the transplant center so I can see this psychiatrist, and I'm gonna sign up for this procedure after talking to the doctor and get that done. And who knows? Who knows? They might just submit my case back to committee, and then they still say no, and they still say that there's more stuff that they need me to do. And I was just talking to somebody else that's on kidney that is also going on that's going through dialysis. And they were saying that what they should do right from the very beginning, when you realize that you have kidney disease and that you are imminently going to ultimately going to end up on dialysis, is what they should do is they should have an entire list of every single thing they need you to do. So that way, when this whole process starts, you know exactly what needs to be done in order to do it. So that way, at the end of that list, you are ready to go and there is nothing else that holds you up. We're going to need a nuclear stress test. We're going to need a pulmonary catheterization. We're going to need a psych test. We're going to need this, and this. And this individual has to get these things done in X amount of time. And once he gets all of this criteria done right from the very beginning, not halfway through when your expectation, when you get your hopes up and your expectations are high and you think, okay, cool, I'm already done with this thing, so now I'm on the list. You call them and they're just like, well, no, you're not done. You got to wait 6 more months. You got to wait 8 more months. You got to wait da 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 da. I've been on dialysis for a year with absolutely no progression in any way towards kidney transplant, because the people who are supposed to be able, the people who are in a position to help me just said, fuck him. We don't care. So I eventually had to get pissed off enough to actually start making phone calls. And it shouldn't be like that. It shouldn't be like that. But that's what I believe. I believe that there should be a list right from the very beginning of every conceivable thing that they need you to do. And then they can add and subtract based off of the test that they're getting back from you in order to expedite this process. So that way you're not getting your hopes dashed on the rocks when they tell you that no, you're not on the active recipient list. You have to wait.